but I'm actually here to be optimistic today. Might surprise a few of you that have heard me speak before. But in order to solve large problems, you have to be optimistic because otherwise you're dead in the water before you start. I'm also optimistic because I actually truly believe there is an unbelievable opportunity for radical change, and it's ours to make something of it. What is this opportunity? The opportunity comes not just from knowing the right answers, but actually making sure we have the right question, then competing the hell out of the right answers. And that last bit, as you can guess, is a great fit for Texas. But let's go back a little bit to this issue of what answers do we have today, and are we missing the right questions? So let me start with an example. About 20 years ago, there was a seminal piece of work that was done around diabetes and getting us out of the mess of diabetes. And I'll just tell you, they had the answer. It's published, it's accepted, it's not controversial. So if all was going well, we'd be in a world without diabetes. Let me assure you that is not the case. 30 million plus diabetics in America and 80 million plus pre-diabetics. What does pre-diabetic mean? You could say pre-diabetics is not a disease, and yes, pre-diabetes is a disease because it's the pipeline that just pushes you right over into diabetes. And each one is just a gradation. It's just a little bit worse than the step before. Huge problems. You put that together, you have a third of the population of the US impacted. So I said we had an answer 20 years ago. What was that answer, and why did nothing happen as a result of it? Well, the answer was to the question, how do we deal with diabetes? And in order to test certain responses, they looked at a few things. First, they said, what if we did nothing? I'm for that, always. That's my starting point, the easiest solution. So they looked at that. And then they said, well, what's the best trick on the market? And that's a drug, metformin, the most prescribed drug in the US, bar none. So they tested some people with metformin. And then the third option was intriguing. It was not a drug and not doing nothing. It was doing some physical activity, a little bit of walking around, and some nutritional education, learning what's in your food and whether you should eat it or not. This package and the tests that went with it was called the Diabetes Prevention Program, and they looked at what worked and what didn't. Well, let me just take the suspense out of the room. Unfortunately for me, doing nothing did nothing. So let's put that on the side. So next you had a drug. It's a pill. You just pop it, you take it, all good. The reality is actually solutions with pills aren't that great because people forget to take them, and sometimes people don't want to take pills. But still, if that was the answer, fabulous. And in fact, taking metformin was better than doing nothing. Great. What about that last path where we looked at exercise and some education, sort of squishy sounding stuff? I'll tell you, they didn't design it squishily, though. This was very specific. It was a protocol, how much exercise you did, how much education you got over about 24 weeks. Not that long. We're not talking 10 years here. The answer is that doing that package of things was doubly as effective as taking metformin. Doubly as effective. This is not 20% more, 50% more, but twice as effective as the most prescribed drug and the drug you normally would take for diabetes, which is better than doing nothing. The reality is, if that other arm, this arm that I just told you, we call these arms of trials, right? The things you compare against each other. If this other arm had been another drug, drug B, drug magic bullet, whatever, you know what would have happened. 50, 100, you name it, biotech companies would have come up to make more of that drug. That's a huge opportunity, definitely for outcomes and definitely for business. And yet, nothing happened. It just sat there. Now, the reason it sat there was it was an answer that no one was shining a light on. There was nothing to do with physical activity and nutritional education. There was no company that could create a drug or package it up and then sell it to someone who'd actually pay for it. So if you think about it, this is a little bit like that story about the guy that's looking for the key under the street lamp. And he's looking for the key, and the policeman comes up and says, hey, what you doing? He's looking for a key. And the cop says, well, let me help you. Wonderful, great cop. They work together. They keep looking for the key. Hours later, no key. And the cop says, hey, and where did you actually drop this key? Oh, a couple of blocks away. Well, why are you looking here? Because the lamp is here and the light is here. It's funny, but in fact, all of healthcare is like that. We look where the light is shining, and the light is shining where the current industry puts the light. And so the current industry wasn't interested in the answer, the correct answer, of twice as much effectiveness through a specific protocol that just didn't look medical, nor was it a drug, and nobody knew what to make of it. So it sat there because the light wasn't shining on it. So let's fast forward 10 plus years, and we get to around 2012, where now all of a sudden, because of the ACA, pros and cons, whatever, it was the first time we had some incentives to actually to have healthcare institutions actually care about what happens to populations and communities around their settings. So for the first time, hospitals, for example, were a little bit on the hook around chronic diseases of the patients that lived around their perimeters. So for the first time, they went, I wonder how we deal with this. We don't have the tools. And so when there's an opportunity like that, because there's a potential of being paid, we start getting a little bit of business churn, which is good. And so where did this start? This started with the people that had the money to invest in new solutions, which was in Silicon Valley. So that's fine. It's money now coming into a space. And people started looking at, well, what's around that we can make into some kind of an intervention? And what did they look at? They looked at the diabetes prevention program and went, wow, we've got a solution waiting here for a product to be created. Great. But who starts building the product? What happens in Silicon Valley? Tech. So now we have tech people going into healthcare. None of this is bad, by the way. But it's interesting that that's where it comes from. And they go, well, how do we take what we learned from the diabetes prevention program? We do tech. So can we take that physical protocol and nutritional education and make it into a tech product? And so over the last 8 to 9 years, we've had a plethora of big companies, some of which are going to be the unicorns of the next 5 years. Whether they stay in business or not is a different issue. But these are large companies with massive amounts of investment that create digital tools that actually implement the diabetes prevention program. And that's because it was always a solution ready to be used. It just was that nobody wanted to fund and pay for it. So we've got that going. And do you think that gives us the results we want? No. It is true that we now have a different spotlight, right? This new area where now you're actually using the results that we had. It's being funded a little bit. Great. But that too is still being spurred by the fact that we have companies that have certain tools at their disposal. What are those tools? The digital tools. And so digital health starts emerging after 2012, many of which are actually trying to implement this program. Great, and yet not optimal. So what is the answer from all of this? Do you think we've solved the problem of how we take a known, proven solution and deploy it across to everybody that needs it? No, we've gotten better with digital health tools, but that's actually not the answer. And if you look at the kinds of results they're getting, it's better than nothing, but it's not to the full potential of what the diabetes prevention program could do. In fact, 7 insurance companies tried to test this out. The CDC has proven out and certified diabetes prevention programs. So the insurance companies tried to actually implement these programs. Some of it worked a little bit, some of it didn't work. And what did they find? They found that, in fact, there were not enough providers. So here you have a business, potential payment, proven methodology, and now there are not enough providers. And the reason is it's an immature marketplace because it hasn't really borne out. It hasn't got enough funding, and we need to think differently about who actually delivers this kind of health in order to maximize this potential. And just to be clear, this potential, I just talked about diabetes. There's not much just about it, with, as I said, a third of our population being impacted one way or the other. But this is about, the evidence suggests, almost up to 80% of our health is going to be defined by activities such as physical activity and what you eat, whether you have a social connection. Do you meet somebody? Does your older parent talk to somebody on a regular basis, or are they sitting alone in their home, isolated? These are all things that make measurable impact. So how do we shine a light that doesn't go to one spotlight or another, but really floods the area out so we can quickly find the keys that are sitting around and are available? That's the opportunity that's available to us. And I believe that not only the country, but actually Texas has a particular place and a particular role to play. And the reason is it's a massive opportunity. Texas is about thinking big or going home. I'd rather think big and stay at home here. Thank you very much. Let's make use of that opportunity. It's huge. There's a large chunk of our $3.6 trillion that we spend. That is not small change. There's a chunk of it that is available if we were to deploy it in a way that those who could provide this new kind of health actually could make some money off of it. That then creates a space for a whole bunch of tools and a whole bunch of widgets that could then further improve health and healthcare. What do those providers look like? Those providers look like People that know elderly people at home, Meals on Wheels. People that know kids, where they live, work, eat, and play, maybe the Boys and Girls Club, maybe the YMCA. Is that all we need? Perhaps not. Maybe we need companies like Orange Theory Fitness that runs franchised operations across the world and has really created a repeatable model of physical activity. But it's not one or the other. You can't take Orange Theory Fitness and throw it at school kids. And you can't take the Boys and Girls Club and say tomorrow becomes some big franchise operation that implements this at scale. You need both. You also need clinical expertise, in which we have a lot of in Texas, to define which populations, which conditions, and how do you map these businesses onto the right areas. And then you need the generation of evidence, real hardcore evidence. But I'm going to come back to what it is we want competition on, because I do believe that competition is the right thing in this space. We don't have time to waste. Let's use the power of competition. The problem is we've not been using the power of competition for the right things. Let's open the space, and instead of saying we have to spend money on a hospital or a clinic or providers, clinical providers of some sort, let's open it up and say, let's compete on results. Let's see who can do the best with diabetes in an area and pay them for the results. Let the best win. I think that's something that Texas is particularly well suited for. And we have money at stake. We have money that's available to us, that's sitting around, and we can use it in a uniquely Texan way to compete for results. And when we compete for results, we will get to substantially better health for the people that we serve. So I look forward to creating an entirely new marketplace for a new business of health that draws from the talents that exist in Texas and leverages the opportunity that is not trivial. It is a massive opportunity, and it's just sitting there waiting for us to leverage and to be creative with.